Hi, my name is Megan Teckley. I'm a clinical nurse specialist student at Detroit Mercy. Today I will be performing a physical assessment on my patient here, Jonathan. Do you have any concerns today?
No.
Okay, so I'm going to start off with some hand hygiene, washing my hands. Now moving on to the general survey. This is a 27-year-old male. He does not appear to be in any acute distress. Breathing is even, non-labored. He appears to be calm. No cyanosis or visible discoloration. So I'm going to start with the head, eyes, ears, nose, and throat assessment. So I'm starting with inspection. I'm looking for symmetry, any masses, lesions, abnormalities. And I'm also looking for facial symmetry as well as any abnormal facial movements, none of which are noted. So I'm going to move on and palpate the head here. I'm feeling for any deformities, lumps, bumps, lesions, deformities. Okay, none of which are normal. And the head does appear to be symmetrical. So we're going to move on with the whisper assessment, or the whisper test of the ears. So I'm going to have you open one ear. I'm going to whisper 3 words. You're going to repeat them back to me, and we're going to repeat on the other side.
Soccer, basketball, baseball.
Good. So here on the right ear is a 3 out of 3. So we're going to move on to the left ear and repeat.
Green, yellow, skiing.
Okay, and here on the left ear is a 3 out of 3. So that all appears to be normal. We're going to move on to the eye assessment. And I'm going to start with flashing a light in your eye, okay? Can you just take your glasses off for me? Okay. Okay. Oh, sorry. Okay, now follow my finger. Okay. Now don't move your head, just follow my finger with your gaze, okay? Okay, so cranial nerves 3, 4, and 6 appear to be intact. EOM is intact. Pupils are equal, random, reactive to light and accommodation. Light reflex is direct and consensual. So we're moving on to the assessment of the mouth. I'm assessing the lips. I'm looking for symmetry, any cracks, lesions, crustiness, none of which are noted. And they appear to be pink and moist. So I'm going to have you open up your mouth. I'm going to flash a light in here so I can assess your mouth. Okay, and I'm looking for any, tooth deformity. I'm looking for any oral lesions. For the mucosa, it appears to be pink, moist, and intact. I'm going to stick a tongue depressor in here. Stick your tongue out for me. And down, say ah. Okay, so tonsils are a grade 1. So the assessment of the mouth appears to be normal. Okay, so moving on, we are gonna go, oh, and I also forgot to say uvula is midline, and the hard and soft palates were visible on inspection. So we're gonna move on with the lymph nodes. So I'm just going to palpate. We're going to start with the pre-auricular, posterior auricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical. The deep cervical is usually not palpable, but moving on to occipital. And finally, supraclavicular. Okay, so the assessment of lymph nodes, none of the lymph nodes were enlarged or palpable on assessment, so all the findings are normal. And so I'm going to auscultate for any bruise. Well, let's start with the thyroid assessment. I'm going to I'm looking at the thyroid. I'm looking for symmetry. Can you just swallow for me? Okay, and again, okay, so I'm gonna displace the thyroid to the left here, and I'm gonna palpate with the fingers on my right hand. Okay, and left, and palpating. Okay, so everything appears to be normal. The thyroid is symmetrical. I'm now gonna palpate the carotid arteries, starting with the left carotid artery, and I feel a nice good bounding pulse. The rate is regular, rhythm is regular. Now palpating on the right side. Okay, and now I'm just gonna auscultate, listening for anything abnormal, any bruise, using the Bellamy stethoscope. Okay, so burst up stroke, no bruise or thrills were auscultated. Okay, so you're going to assess for range of motion. Can you move your hips to the right for me? Move it to the left, up, down, shrug your shoulders for me. Okay, so patient has full range of motion of the head, neck, and shoulders. So we're gonna move on to the thorax and lungs assessment, starting posteriorly. Can I just have you slide down here? Slide down here. Okay, so we're gonna inspect the skin. First of all, chest expansion appears to be normal, it's symmetrical. No accessory muscle use or any abnormal breathing. Nothing is audible with the ears. And same thing with the back, everything is symmetrical. We're inspecting. Chest expansion is even, unlabored, symmetrical. Skin appears to be intact. No bumps or masses or lesions or anything abnormal is noted on inspection. So I'm just gonna quickly palpate, feeling for anything abnormal, any heaves or lifts. Okay, so I'm gonna move on and begin auscultating the posterior lung sounds using the diaphragm. Okay, can you just inhale and exhale for me? Again. Can you say E for me?
E.
Okay, so upon my posterior lung sound auscultation assessment, the lungs, the left lower lobe, I was able to hear expiratory wheezes. When testing for egophony, I heard E when the patient said E, so egophony is negative. And for all other lobes, it was clear to auscultation. So we're going to move on with the assessment of the anterior lines. So again, I'm inspecting chest expansion is even, unlabored, symmetrical. I'm inspecting the skin. Skin appears to be intact, no bruising, bumps, masses, lesions are noted on auscultation. I'm just going to quickly palpate to feel for any of those masses or deformities. Okay. Okay, so I'm going to go ahead and listen with the diaphragm. I'm going to start up top at the apices, because that's where TB lies most of the time. Okay, so lung sounds for clear auscultation, no accessory muscle use, no abnormal Lung sounds were auscultated, no rails, no roncas, no wheezes, no crackles were noted. So the assessment of the anterior thorax is normal. And I forgot to say this, but we are gonna move your head to the left or the right to avoid coughing in my face. So we are going to move on to the cardiac assessment. So I'm gonna listen to the heart sounds with the diaphragm of my stethoscope. Okay, so just move your head. Okay, so I was able to palpate the aortic, pulmonic, Erb's point, mitral, and tricuspid. S1 and S2 were noted on auscultation. I'm also just going to palpate for the point of maximal impulse. Okay, so now we are going to, I'm just going to have you move forward to bring your chest wall forward. I'm going to ask you to blow out air and hold while I listen over the right sternal border. Okay, an auscultation was performed with the diaphragm and my stethoscope. I was unable to hear any aortic murmurs or aortic stenosis, so that assessment was negative and the findings were normal. So now I'm going to be listening for any murmurs, mitral stenosis, S3, S4, abnormal heart sounds. So I'm going to have you come and just lie down on your left side to do this part of the assessment. Okay, and I'm using the bell of my stethoscope and I'm listening over those same 5 spots. Okay, so no S3, S4 adventitious heart sounds, mitral murmurs, or mitral stenosis were audible upon auscultation. So now I'm going to move on to the final part of the assessment. I'm just going to have you lay flat, and if you could just do that on the right side of the bed, that'd be great. Okay, and we're assessing for jugular vein distension. Okay, so I'm just going to bring the shirt down a little bit. Can you move your head to the left for me, please? So the patient's at a 30-degree angle. I'm on the right side. I am assessing for the right internal and right external jugular veins. I'm looking for a pulsation. Okay, I'm just placing a landmark on the sternal angle here. Okay, I'm looking for the pulsation at the highest point, and I'm just going to measure that. Okay, and it's only 1.5, so no distension is noted. Venous pressure is negative. It's not noted or not detected, so this patient does not have an elevated venous pressure. So the assessment of JVP is negative. All findings were normal, and that concludes our assessment. Thank you.